Welcome, and thank you for your interest in DocuPRO. Over 200 therapists from across the country helped to develop this breakthrough documentation system. It's fast, easy to use, and creates professionally designed reports that impress referring physicians. Todd Cadby, the owner of Rehab Physical Therapy in North Scottsdale, Arizona, was one of the first PTs to switch to DocuPRO.
I've been using DocuPRO since 1993, so I'm in my 13th year, and it has facilitated my practice's ability to track treatment, to record treatments, and then to regurgitate treatment to those sources that always will need it, including litigation sources, lawyers, insurance companies. DocuPRO is an electronic charting system. It gives the clinician an ability to create a fast, effective report on what the treatment has consisted of that day, in addition to creating care plans or formal letters of documentation that you then correspond with or utilize to correspond with the insurance companies and your other customer, who would be the referring physician. You could function off a wireless network, which is the way we do it. So the laptop goes into the treatment room upon the first visit. And as I gain the history of the patient, I am able to capture all the information into a templated version of DocuPRO. So the questions I can ask, I can take their responses and easily, from pick list, put them into the computer. Then I move on to an objective format, which is where the examination occurs, where I'm going to perform my testing and examination. And there are templates with pick lists that I can pick from that are going to fill those slots. The templates are broken into the body parts or body regions. And so when you go in to fill in the template, as I go through the examination, there's a couple advantages to this whole system. The first is that it will take me through a systemic flow of my examination. So prior, if I started to fall off on one point or I started to go down one path, I may forget inadvertently that I would need to go down another path to do a full examination. DocuPRO keeps me on a very smooth system flow going through the examination, so I don't miss anything. You have the ability to create free text, or in other words, your free thoughts by typing those in wherever you like. So although you're not doing handwritten notes, which is a bit archaic these days and slow, you do have the ability to put your unique thoughts that may not be covered in the templates into the note anywhere you so desire. So you can still create the unique note. It is not a cookbook approach. From the perspective of clinical application, I just can't say that enough, that I believe one of the best attributes is that it was written by physical therapists, and there are many templates that cover beyond orthopedics as well. Vestibular rehab is one. TMJ afflictions is another whole series of templates that are very helpful for the clinician that may only see those afflictions occasionally, because now I have a template which is a tremendous tool that will keep me on flow with something that I may not see on a frequent or regular basis. And I may not have a lot of that examination already memorized or remembered from 10 years ago when I took that course on TMJ. It also captures CPT codes underlying the procedure that you performed. So perhaps there is manual therapy involved, of manipulation of a joint. There's a CPT code that's used for billing and the insurance company for that. DocuPRO has built into it the CPT codes that electronically then can be downloaded or automatically download to the billing system. It captures everything that you do in the treatment. Everything that we do in the treatment is not always billed. And so consequently the billing system or the biller or the billing company can then see everything that you performed and then create the hierarchy so you have the best payment or revenues out of that treatment. It does ensure everybody that needs to get billed will get billed, and as importantly, it ensures that anybody that was put on the schedule through AppointmentsPRO as being in the common database will be documented on, as is required by the law. So consequently, there are no patients that fall through the cracks. So it's very good tracking of the patient. It's very good tracking of the patient's compliance. The home screen of DocuPRO, when you open it up for your day, will have all of your patients listed on the left. And with that, then, it will identify patients that need documentation for that day or are missing documentation from previous treatments. It does this through different colors. The name may be highlighted in. It also shows you the ICD-9 or the diagnosis code that they're in. You can easily open up a branch or a tree of a patient by just clicking on the patient or double-clicking on the patient. It will open up every note that's been completed on that patient, and it will show you ones that have not been completed. So let's say I was treating John Doe that day, I got busy, and I forgot to sign the note. So the note it still needs to be completed. And 2 days later, he's flashing. It's just flashing. It's saying John Doe is still here, and there is a note that has not been completed, which is, again, like we talked previously, keeps the clinician on track with documentation, which is, you know, in all essence, a laborious task. It's one of the tasks that the clinician needs to do every day, but to make it that much more efficient and complete decreases the workload ultimately by the end of the week. Because I'm not trying to make up notes, I'm not trying to scour, search hard copy notes. Did I do that note? Did I not? It's automatically flagged in the program. And it's also good for supervisors, directors, for tracking documentation of the staff that works for them, the clinical staff that needs to document daily. The director or supervisor can go into another clinician that works for them, into their history, into their documentation, into their schedules, and see electronically everything that's occurred or occurring. Another attribute of the program is to keep everything electronic, keep a paper trail, but it's an electronic paper trail, which obviously decreases on the need on, again, operations, labor, filing, archiving, storage units, et cetera, et cetera. It's easy to keep track of the patient's progress for when I need to do a status or a comparative note. Let's say it's 2 or 3 weeks later. I can do a progress note. Again, I can take the computer, the laptop, the tablet, whatever, into the room. I can input the information right then and there of what my measurements are, and DocuPRO, then I can create a summary report that does a very nice comparative table showing how the patient was on this first date that I saw them, and then the progress 2 to 4 weeks later in not only the subjective detail but also the objective information in a table format. So in the end, the DocuPRO goes with me into the treatment room to do my initial exam. Then after I see the patient or later on in the day, I take that information and DocuPRO puts it into a very nice summary, typically 2 pages, put on my letterhead that then I can then send to the physician for their information, for their signature. I can utilize it with the insurance company for payment because it has all measurements, objective as well as a subjective history combined into it's easily read format. Most importantly, what I see with it is the ability to create an extremely classy and formal note that is consistent for the physician. So the physician understands what is occurring in physical therapy. The physician has referred the patient to physical therapy and is now seeing what is occurring in physical therapy and how much detail that physical therapist using DocuPRO is putting into the care of the patient. So the ability to market the practice with a standardized report that I can still uniquely create as Todd's report, but yet have all the standard information, which is at times redundant, repetitive. The computer will help me expedite that process.
Just like Todd Cadby, you know that electronic documentation is the wave of the future. So, if you've been holding out for the right system, now is the time to move to DocuPRO. To find out more, call SpectraSoft now at 1-800-889-0450 or log on to www.SpectraSoft.com.